Lori, what are the financial rewards for offering wellness programs?
Well, I think like DTR had a lot of their statistics up there on the financial rewards, but basically finding out, you know, when you do the wellness and you find out that you have a high percentage of people with this and you're offering a program to help reduce those, definitely can reduce some of your insurance costs. I think there are some insurance companies here that offer some kind of credits and things, and you can just, you know, talk with your insurance companies. A lot of them offer, especially the smoking, I know that's a big one, where if you quit smoking, they'll give you a percentage rebate on your insurance premiums on the employees themselves. So I think those are some definite, those are immediate savings that companies can get from directly from their insurance companies. For the workers' comp, obviously a reduction in injuries is a reduction in premiums that you have to pay to the state.
You said that DTR uses a BMI index of 25. There's been a lot of reference here to BMI. Can you explain how you chose 25 and how does that relate to the average male as far as height and weight and the average female as far as height and weight?
What we did is we used the Center for Disease Control, their recommendations as far as determining what we were going to use. Now, we did receive pushback, of course, from our associates. So, because the first announcement was that we were going to use BMI. But then, of course, you have men that are muscular and maybe considered overweight. So that's when we took the waist measurement also into effect, to where if they could pass one or the other, then they meet the criteria. And again, the waist measurement is the same. It's from the CDC.
Emily, I heard your presentation at Bluffton. Mr. Hardeth hosted us, and maybe I'd like you to explain to the group of, in the beginning, when you started doing some of the health assessments, the reward was a reduction in their premium if they participate in all these programs. How long did it take the naysayers, which I imagine at the beginning said, well, we're not going to do this, but then they saw their co-workers getting rewarded. Did that change within 2 years, 3 years, or some, I imagine it doesn't change at all because they like to smoke or that. But could you get into it? Could you reference that at Bluffton? I thought it'd be interesting information.
Well, we implemented the requirements, and we started talking about it in 2008. And then we actually implemented it in 2009 for 2010 premium share. And we saw in 2010, with the premiums coming out of the checks, that in 2010 and now here in 2011, the same people, for the most part, are not complying. And it's just one of those things that, you know, we're just going to continue to educate them as far as the importance of these requirements, and hopefully with time we can change their minds, because it's in all, not only for our bottom dollar, but for them and their families to change their lifestyles.
When you hire, do you go over these policies, and does that deter some people from following through on employment requests, or how does that work?
To make it clear that when I say required, I mean it loosely. It's ultimately up to them if they want to do these things. We are asking them to do that, and if they choose not to, then they pay the premiums. Very little pushback. I think with our education, and I showed the stats up there that 10% was the most that's not complying of a little over 1,000 people that we were asking to do this. So for the most part, we have the buy-in, but you still have that small percentage that's just not going to, and we can just continue to work on them. That's all we can do.
Doctor, can you speak to just briefly about, they're pretty obvious, but the downside of not jumping into kind of a wellness program for employers, employees alike, this program for employers, employees alike?
Well, I guess you can pick any category. Obviously obesity, tobacco abuse, chronic back pain, I mean, if you don't do anything about it, you're gonna die earlier than expected. I mean, you can't say it any more plainer than that. You're gonna lose 5, 10, 15 years, good quality years to your life. And I mean, some people, and it's a frustrating thing from a physician's point of view, is that you can educate them and you can make them aware, and then they make the choice. And some people choose, well, hey, you know, I'd rather die smoking than, you know,
Live
no.
not smoking.
Right. And you gotta support them through that. You help them the best you can with the choices that they make. But my job is to help them live longer, more quality years. And any risk factor, from heart disease, diabetes, obesity, you know, all those things can be prevented. You know, and it takes an effort. It takes some effort and takes discipline, and that's why having a physician-patient relationship and a team approach, accountability, and supervision helps that patient stay focused, stay implemented, and get the results that they need.